I thought I'd just talk for 10 minutes, not a long time, because I want to hear as much from you as possible. I do tend to give long answers, though, so when you ask me a question about something I haven't talked about yet, you may get a longer answer than you'd like. I wrote the book because I thought there was a desperate need for a book that explained healthcare in plain English. This is an incredibly arcane subject. It's clearly the most complicated domestic policy that we have. Everything is connected to everything else, and it's very hard to understand. And it's usually put together by people who really know a lot but have trouble communicating communicating in a straightforward way because it's so incredibly complex. I have two wonderful co-authors, Faiz Shakir and Igor Volsky of the Center for American Progress. They started out as fact checkers, but they ended up writing a number of chapters. In fact, they actually rewrote the whole book, which then I had to rewrite again to make sure it was still in English. No, I've just teased them about that because they're really wonks and they really know this stuff cold. And it was a lot of fun to work with them, and I want to thank them for what they did. A couple of things about healthcare. The first is I will say that I've been at this for 30 years. I convinced the dean of the medical school I went to, Albert Einstein College of Medicine, to let me come to Washington for a month, theoretically an elective my senior year in medical school. And I followed Senator Javits and Senator Kennedy around the Hill as they were putting together a universal health care bill for Jimmy Carter when he was president. Several years later, I was involved with Senator Clinton's, now Secretary Clinton's, task force through some staff people that we had permanently assigned to the task force. And now in my later incarnation, it's the President Obama's bill. This is the best bill I've seen. Not because it's perfectly designed, because no bill is perfectly designed and no system is perfectly designed, because it's perfectly suited to the American people. And I know you're hearing all kinds of outlandish things about the bill, almost none of which are true. Here's how the bill works. It's incredible, and I think Obama's people have understood the nature of how to change things better, which is why it's such a threat, why you hear this incredible. I've never heard criticism of the kind that I've heard now, death panels in the bill and all this kind of stuff. I mean, people take that seriously. They want to believe it, the people who do believe it. It's a difficult age. We're making great, huge transition here between my generation and the new generation that put Barack Obama in power. The under 35s, in this election, more people under 35 voted than people over 65. This is a huge change for Americans, and obviously with change comes discomfort. But here's why it's a great bill. The president and his people recognized during the campaign that America is a conservative country with a small c. That is, we always say we like change in America, but we never really want quite as much as we say we want once we go inside the ballot box. 80% of Americans have health insurance. Of that, about 80% are pretty happy with their health care. The other 20 have lousy health insurance, and then there's, of course, the 20% roughly that don't have any. But that still leaves, if you do the math, 65% of the people roughly with health care that they like. And 65% always beats 35% in a democracy. So what the president recognized was you can't arbitrarily force change on the American people, especially when 65% of them are reasonably satisfied with what they've got, except for the cost. So what he did is give people a choice. You can keep what you have if you like it, but we will give you a choice. If you don't have insurance, or if you have insurance that you don't like, we will make available to you insurance that cannot ever be taken away, that costs the same price whether you're sick or whether you're healthy, that stays with you even if you lose your job. It stays with you if you move from Washington, D.C. to Seattle or Honolulu. And that exists today. Essentially, it's Medicare. We've had government-run health insurance in this country for 45 years. It's Medicare. Most people like it. I get a kick out of the people who get up in town meetings and say, don't give me any government-run health care and don't you touch my Medicare. So essentially what this plan does is allow you to sign up for something like Medicare. Now, there have to be some adjustments. Medicare is far from perfect. I remember 15 years ago as a physician railing against Medicare until the insurance companies did what they did over the last 15 years, which is to stick it to doctors, particularly primary care people, and stick it to patients. You get complaints at these meetings that government bureaucrats will stand between you and your doctor. What about the insurance company bureaucrats? They are already standing between us and our doctor. So the basic, look, just to cut to the chase in this book allows healthcare reform not at the pace that Congress wants it or the insurance industry or anybody else. It allows healthcare reform at the pace that you want it. You can keep what you have, or you can sign up for something else. And when you sign up for the something else, you still have a choice. There'll be a government subsidy depending on your income, and you can use it to sign up for a private program or a public program. So you get to control, the American people get to control the pace of reform. It's really smart. Now, for those super duper reformers who want to get everything done as soon as possible, it's not fast enough. I understand that. But I think it's much wiser in a pluralistic democracy to leave the pace of change up to the ordinary American people, because that reduces the fear factor. And to see the extent which people have had to say things about this bill they've never said before shows you that how desperate the opposition is to crank up the fear factor. You can't just crank it up by talking about socialized medicine, because people had socialized medicine for a year. You know, there's 4 groups of people in America who have socialized medicine. One is everybody over 65. This is by the Republicans' definition. One is everybody over 65. One is veterans. One is people on Medicaid, mostly poor. And the other is the people who complain about socialized medicine, scream and shout and hoot and holler. It's the Congress of the United States. They go downstairs, they see the doctor, they don't get a bill, they get sick, they go to Walter Reed. How come we can't have that, huh? So, here's the bottom line of this book. First of all, it's a lot of fun, this book. There's a chapter on how a lot of other countries do it. There is a chapter on what you should do about the 12 myths that the conservatives are going to tell about health care and the public option. Here's the answers to all that. We didn't quite cope with the euthanasia myth. We didn't quite think they'd go that far. There's a couple of chapters about what you can do as activists to get involved, and you go various websites that you can go to try to make your views known, and so forth and so on. The bottom line is this, though. If you don't have a public option, it's not reform, and you shouldn't do it. If you don't allow, we're not asking Congress to reform the healthcare system. We're asking them to let us reform the healthcare system at the pace that we choose. If you don't want a public option, you shouldn't sign up for it. And furthermore, if you do sign up for a public option and you don't like it, you can leave and go back to the private sector. So this gives the American people the chance to reform healthcare at the pace they see fit. And I think that's the right way to do it. And so we frame it this way. First of all, if there's no public option, there's no reform. In that case, you can do a few things to the insurance companies, which we did years ago in Vermont, guaranteed issue and community rating. That means you can't deny anybody health care insurance, and you can't charge sick people, a lot more than you charge healthy people. We just do that. That doesn't cost any money. You just do that. We should not spend $60 billion a year, which is what the House bill is scored at, and put it in the private insurance sector. It's throwing money out the window, and it's just going to make things worse, not better. So if you don't give us a public option, don't pass a bill. At least don't pass one that costs any money. Here's what I think the fight really is. I mean, there are those who just can't stand Obama and never did like him, and they just want to ruin his presidency, and that's obviously Jim DeMint spoke about that, Senator DeMint. But the real debate is this. 72% of the American people think Americans should have the choice of whether to have a public option or not. 50% of Republicans think they ought to have the choice. Most of those people are not going to sign up for a public option. They think they ought to have the choice. So this turns out not really to be about Democrats and liberals and conservatives and Republicans. This is about whether you want to vote with the insurance companies to keep them in business. And they're going to stay in business no matter what. And I don't think we ought to try to push them out of business, because they do. There are big plans and stuff that do good things. But they're going to stay in business. Are we going to keep them doing the same things that they do to consumers and physicians now? Because if you are, then you vote no against the public option. But if you want to give the American people the choice, you vote for the American people. And 535 people are going to have to put themselves on their record of that. Do you vote for the insurance companies, or are you voting for the American people? Because that's what this is really about. And the other thing it's about is who chooses. You want to let Congress choose? You want to let bureaucrats choose? I don't. I want to let the American people choose. If you don't like a single payer, you won't have one. If you want to be in a single payer, like everybody over 65 is, you can do that. If you want to get in and then get out, you can do that too. That's what the genius of Obama's plan is. and I hope it passes. Thanks very much. Happy to take comments, questions, and rude remarks if necessary.